how do you we one whole human of emotion?
Wow.
How do everyone when you know that God made you?
Oh, that is a very, very difficult question.
That other many no of other one the in my better and the color who not only had done many valuable surgery, but also is a gay human being.
Anand, it is my pleasure to be here today with you. And I was really looking forward to be joining your questionnaire and your program. Unfortunately, we had to delay so many times, and you have been very patient. And thank you so much for giving me this opportunity to be with you today.
Yeah. I know you did very well in all India and in India.
Yes, thank you very much for that.
How did you get involved with become a cardiologist?
So, Anand, I was inspired to become a cardiologist, in which we do more of interventional cardiology, in which we do stenting, we do pacemakers, we take care of heart attack patients. It's a little different from a cardiac surgeon. I got this inspiration because my parents have been practicing in Delhi as doctors, and now last 45 years they've been practicing as doctors. But the real inspiration came from my grandfather, where my grandfather, he had a cardiac ailment and he never got attention of a cardiologist. It was very difficult to find a cardiologist in this area. And so I decided to become a cardiologist and serve in this area where there was actual deficiency of good doctors.
And there is more many from under cardiology.
Yes, the medical conditions of the heart, they right from the congenital heart disease but that also been diagnosed by cardiologists. And majority of the time, we are taking care of diabetic patients and the problems of the heart that are caused by diabetes and hypertension, along with patients having heart attack or other kind of cardiac problems like arrhythmias. Are patients are having electrical disturbances of the heart, or the patient is having dilated cardiomyopathy in which the heart becomes expanded and big and is not able to pump properly. So these are the major diseases that we take care of.
Some are then about in some in it could be a hard disorder. how can we differentiate between my and how the other?
Yes. So many times, a lot of people during their life, they may experience chest pain. Now, chest pain can be on the right side or it could be on the left side. From any problem of the skin, which could be like a herpes infection of the skin. It could come from any infections of the bones. It there could be myelitis. These are the infections, or there could be sometimes problem of acidity, which is of the esophagus, or of the stomach, which is of the gastritis. Other than only having problems of the heart and lung. So we are able to differentiate because in each cases there may be some associated symptoms. For example, if somebody is having a lung problem, maybe having a pneumonia, because of which he is having a chest pain, then usually that person will have a fever or a cough along with it. If a person is having a gastritis along with chest pain, usually that person is going to have difficulty in eating food, or immediately after eating food, he feels fullness in the stomach, or burning sensation, or having burping, too much burping. Or if a person is having actually heart attack chest pain, then we know that chest pain is mostly associated with difficulty in breathing, and it is also associated with a lot of sweating. And usually it is with people with certain age, with certain time years of diabetes, with certain years of blood pressure that they already have. So that is how we take the history from the patient quickly, and we are able to differentiate between the different types of possible pain. And usually now, after so many years of experience, 99% we are able to pinpoint just by hearing the person what kind of a pain that person is having, or just by the body language of the person we are able to understand how severe is the pain and is it possible to be a heart attack or no. But of course, medical investigations like ECG, echocardiography, they are needed to diagnose properly a heart attack. X-ray may be required to diagnose lung disease, or sometimes an endoscopy may be required to differentiate between these stomach problems.
How do you we my whole stomach are in my head?
Wow. So, as I told you, Anand, that we don't hold the heart in our hand, but we put the wires through the coronary arteries, we put the wires through the heart, and it is always very exciting because we know what we are doing is for the good of the patient, and the problems of the patients will disappear after that. And always it is done in a good faith. We are putting the wire right from the neck right up to the heart, and there is a lot of some blood splashes at that point of time, but over a period of time you get used to it, and then you are just concentrating on your work, you're concentrating on the next step that you're supposed to do to make the patient better. And it is such a pleasure to see your patients give a nice smile to you or give blessings to you after you have taken care of them. So that gives us a lot of strength and happiness.
Yeah. But, but the more any that you have eaten.
Oh, one of the most challenging cases I've had was one person who came to me with a heart problem. He came to me with a heart attack, and his heart had stopped. So we pumped the heart and we gave electric shocks to the heart to make it activated. And immediately we took the patient to do an angiography. And after doing the angiography, we saw that the main artery of the heart was blocked. After that, we have tried to put the wire through that artery, and while the wire was going, the heart had stopped again. So again, we gave electric shock to the heart on the table, and we continued the procedure. And by the time we were finishing the procedure, the patient's blood pressure totally became zero. So we had to put a balloon pump into the patient to activate and to give the blood pressure and to give correct blood pressure recording. So the heart was activated and the balloon pump was put. But while doing this, we had to give a lot of blood thinners because see, every time the blood and the heart is exposed to atmosphere, the blood starts clotting. So we had to give a lot of blood thinners to the patient. And by the night, he came out of the operation, and in the night, he was completely healed, and he came back to life, and he was very happy. After 8 to 9 years, I can still remember that case, and he and his entire family still comes to me.
How do you when you know that can't be your
Oh, that is a very, very difficult question. That is something, we as a student, doctors don't learn, but then we learn it over a period of time. Sometimes it is very, very important to tell the patients about his disease progress so that they can be careful and they make sure that the disease do not get worse. And sometimes we speak in very hidden words and we speak to the main other member of the family so that they can slowly disclose to their loved ones and they know how to manage their family. So it is a very difficult thing even for a doctor, even at this age, even after so many patients that I've seen. This is one of the most difficult thing that we have to do, is to tell the patient or to tell their loved ones that it seems like that the things are going out of control and it may not be possible for us to save this patient. So it's very difficult, very, very painful. Sometimes it's difficult to even sleep after that or even eat dinner after that because it is so depressing. And but over a period of time, we learn the correct way and in the correct emotions that we explain to the relatives of the patient.
I am curious about one thing. We will be our emotion and feeling from our heart. If we monitor the heart, we blood while feeling or being emotional can be seen and in the heart.
Oh, absolutely. We can see a lot of changes when we are monitoring the heart of a person. And when the people are going through different emotions, we are able to see the changes. And very interestingly, that what we talk about, this giving your truth test, doing the ECG, it records our blood pressure, and everything changes with our emotions being happy or being sad or being scared. The constantly the heart is changing. Every beat of the heart is different from the beat before, and every time a little emotion is there, a little stress is there, our heart beats faster. Every time that we are more comfortable, happy and satisfied, our heart start being slower. So each the difference between each beat can be monitored very closely, and we are able to see whether the heart is beating fast or slow. So those emotions are always seen physically while monitoring the heart.
I have bought many of your information video. It is interesting that you reviewing the medicine and getting our life in
Yes, my interest in lifestyle, it grew over last few years because Anand, you should means how do I explain this? That now, after being so many years into practice and taking care of my patients, now I see the second generations of people, their children Somebody's father had a heart attack, now the son is having heart attack. Somebody had a blood pressure, now their daughter is having a blood pressure. Or somebody had diabetes, now their children are having diabetes. So I tell them that if you had taken care of your lifestyle when there was time, you would have not reached to the state of same disease as your parents. This could be avoided because this runs in the family. And then I realized that there is a big gap between what is correct lifestyle modification and what is told in the doctor's chamber. Because usually the doctors are so busy, all they tell is do exercise and don't eat junk food.
Mm.
But that is not sufficient. Lifestyle has many more
Yeah.
many more connections to it, like having a good sleep is important, quitting smoking,
Yeah.
quitting alcohol is important, then reducing your stress is important. Then what are the ways that we can help to reduce stress of a person? A person may be stressed, so we can do by medication, we can do by meditation, we can do by yoga, we can do by just training ourselves to start forgetting our stress, or for lack of sleep, so improving our sleep pattern. What are the correct ways to improve if our sleep pattern? And if we are not able to do it with simple practices of yoga and meditation, then maybe we need to start getting some medication for it. But it's important to keep our sleep, our stress and blood pressure, diabetes, our weight, our exercise, all these things in check. So it interested me in the last few years, and in the last few years I did a lot of research about it, lot of studies about it. And now I have decided to work for it and make informative videos for people, so that in general public can take that information and improve their lifestyle.
Yeah.
What is a balanced diet? A balanced diet, if you're having a plate, in your entire plate, half of your plate should be full of protein. So it could be non-veg, it could be dal, it could be soya bean, it could be any other form of proteins that we are having. Then the other half, quarter of it, it should be lot of fruits and vegetables. So that should be fruits and vegetable. And the other quarter of it can be some processed food, or it can be something like rice, or it can be some other things that we are adding on, or roti, chapati, it can be carbohydrate
Mm.
based food at that point of time. So a lot of protein, a lot of fiber, and a little amount of carbohydrate that we include in our diet